Great pleasure to be here with colleagues and friends and to speak to you today. I thought I would start about telling you where it all began. So I work in early childhood development. And about 15 years ago, I was doing some school readiness testing at a preschool, which was run in the back of someone's house in an area called Alexandra Township. At the time, this was many years ago, the population density was estimated at about 15,000 people, 45,000 people per square kilometer, very low income. And there was a tavern, illegal drinking establishment going next door that was up and running at about 9 o'clock in the morning. And I had this light bulb moment that I knew if we didn't actually help children get on a better trajectory in terms of their development, in terms of their well-being, that they too could be sitting drinking cheap beer at 9 o'clock in the morning. And this really ignited my passion for community work and really shaped my research career from that point forward. And so my work in the last 15 years or so has been about understanding ECD, early childhood development, in the very messy context of South Africa and how it fits into the global picture. So I'm going to start with that global picture. And as Sarah mentioned, I led a Lancet series on early childhood development and the next 1,000 days, which came out in November last year. And really importantly, firstly, to define the next 1,000 days refers to the ages of 2 to 5, following the first 1,000 days, which is from conception to 24 months. And the point is really not to argue that one is more important than the other, but that both of them matter. So I'm just going to give you a little bit of a whistle-stop tour through the series. Firstly, why does the next 1,000 days matter? And I know I'm preaching much to the choir here today. So it's a period of significant growth of skills in young children. It's a sensitive window of opportunity to mitigate environmental risks, promote protective factors, and establish healthier trajectories. It's a chance to sustain and build on gains made in the first 1,000 days, and where possible, recalibrate trajectories where opportunities may have been lost in the first 1,000 days. And the nurturing care framework continues to shape thinking about what children need to thrive in the next 1,000 days. All right. So just a few of the key findings. There were two papers, one kind of making the case for the next 1,000 days and the second one focusing on the economic argument. And it was really nice to hear from the first talk this morning how many of these things that are working or at work in the UK are really some of the key things that we picked up in the series. And that development in the next 1,000 days is multidimensional, it's cumulative, and it's continuous. And we presented some new data, particularly highlighting the mismatch between regions where interventions are most needed and where they are implemented, evaluated, and published. And one of that sets of evidence shows that only 1 in 4 children ages 3 to 4 years old are receiving adequate nurturing care in low middle income countries. And nurturing care, we use an index using indicators that are appropriate for this age group. And it's really not intended to blame caregivers for not providing the nurturing care, but trying to understand what are the systemic and structural barriers that actually get in the way of caregivers being able to provide the care that their children need. But in a review, we also highlighted that interventions promoting development in the next 1,000 days are predominantly delivered in high-income, westernized contexts. And we need more contextually relevant interventions that are globally diverse, especially in LMICs. Also, the issue of quality, of access, of equity, of early childhood care and education programs matter. So it was really nice to see how the point around quality was mentioned earlier on, and that when it comes to parenting and caregiving, we need to build on the investments in the first 1,000 days and do more in that area. From an economic perspective, the evidence presented in the second paper in the series showed that the cost of inaction in the next 1,000 days is large, especially in low income countries, and providing 1 year of quality universal ECCE costs on average less than 1% of GDP. But the benefits range between 8 and 19 times more than the cost of implementing these in LMICs. And these need to be complemented with relevant health, nutrition, cash transfer programs in order to support children's development in different contexts. And children in the next 1,000 days need to be more visible in policies, hear their voices, as was mentioned earlier, and strategies where their health and their development are affected. And we need to pay more attention to the most vulnerable children, children with developmental disabilities and delays, those exposed to the harmful effects of pollution and climate change, and importantly, those who are caught up in geopolitical conflicts. So, moving from the global to the local, South Africa is an upper middle income country with extreme inequity. I think it's the worst in the world, due to legacies of colonialism and apartheid. And contrary to some of the media, white people are not persecuted. It's actually the other way around. But we do have a history of a very neglected ECCS sector. The government does not provide universal ECCE, and this sector in very many ways is propped up by civil society. There's been some recent support and momentum around the next 1,000 days, but we've still got a long way to go. And any of our interventions need to take into account contextual realities and lived experiences. And the next 1,000 days in our country refers to the preschool age group. So when I talk about preschool children, it's this age group. So I'm first going to just go briefly through some of the measurement research that we've done, because when I first started working in early childhood, we realized there wasn't a whole lot out there. So we were trying to understand what needed to be done. And my work at that time was very much on what we call movement behavior. So physical activity, sedentary behavior, screen time, and sleep. We wanted to also know, do children have the motor skills that they need to be active? And through a number of studies, we found that yes, they do. And actually, rural, low-income children actually had the best skills with no instruction or equipment, often just lots of space and time to play. We wanted to know, were they meeting recommendations for these behaviors? And we found screen time at that point was actually worse in high-income areas where parents seemed quite unaware of the potential harms of excessive screen time. But we could very much see that there were shifts happening in low-income settings, and particularly rural areas where access to devices was shifting. We found sleep was worse in urban low-income areas, and a lot of that to do with the sleeping arrangements. If people are living in very densely populated houses, sharing rooms and sharing beds is very much the norm, sometimes with the whole family in one bed. But physical activity, they were far exceeding the recommendations. And this is a slide from one of my previous PhD students, which is my favorite to present. I'm not going to go through it in detail, but it really just tracks the pattern of activity between urban high, urban low, and rural low-income kids, and really just to highlight how these behaviors play out in different contexts, that the pattern of their days is very different. And I always do like to point out this kind of surge of activity for kids in a low-income urban community. There was nowhere to play other than the street, the time of day, the time of year. These children were playing in the street in the dark. But this really just helped to highlight how these things were different across different contexts. And what we learned is that this, at that time, very much obesity prevention perspective around movement behaviors just did not resonate in our context. 1 in 4 children in this age group in South Africa are stunted, and the food security is very prevalent. So telling people to be, engage in these behaviors from an obesity prevention thing just didn't work. We needed to view this within the broader context of development. We needed to focus on the behaviors that needed attention. Getting funding is hard enough. No one's going to give you money to improve already appropriate gross motor skills or physical activity in excess of the recommendation. And at that time, due to some of the connections we'd made, we started shifting more to early learning. But the evidence that we collected did support the development of local guidelines around movement behaviors. And that's the infographic that we developed, and those were released end of 2018. So, early learning. Executive function was this kind of new, exciting concept, and everyone was like, physical activity is really good for executive function. So we did some testing, and we actually found that children had better than expected executive function, including in low-income settings, urban and rural. And in fact, for inhibition control, low-income rural kids did better on the same test in the same age group than high-income Australian My Australian colleagues like to remind me it's not a competition, and I reminded them it very much is when it comes to South Africa and Australia. So we won that competition. So we did find it was associated with gross motor skills and with school readiness, but not with physical activity, probably because they were all very active anyway. But we were then interested to say, well, what are the risks and the protective factors? How can we understand how these affect early learning in these particular contexts, things around socioeconomic status, exposure to violence, family dynamics, the home learning environment. And what we found, unfortunately, didn't equivocally answer many of our questions. We did find expected relationships between executive function, numeracy, school readiness, but we actually didn't find the expected relationship between self-regulation and exposure to violence, which has actually been replicated in some other studies, and the home learning environment and numeracy. So we, in many ways, kind of still scratching our heads about this, trying to understand what is it about these contexts that fosters better than expected executive function skills. But we did want to try and see this within context. And so just kind of taking maybe a bit of a wider lens than just the child, looking at from a socio-ecological perspective, and also trying to understand caregivers' perspectives around early learning and early childhood development, and that they actually, in fact, in this sample that we studied, really see themselves as playing this important nurturing role, and their role in developing and their children's learning. So it's not necessarily a linear process, even though it sounds like I'm presenting that. So around the same time, been working around implementation science. And how do we apply this learning to the kinds of interventions that we develop and implement and evaluate? So I work on a big multi-country study called the Healthy Life Trajectories Initiative. So this is the trial that Sarah mentioned. And the trial actually runs from preconception and, if all goes according to plan, following up the child to the age of 5. It's called Bukhali, which means smart or powerful in one of our local languages. And I manage the intervention and control arms of the trial, as well as the process evaluation, which I'll talk a little bit about. I developed the early childhood components from 2 to 5. That's called Bukhali Umntanakho, which means Bukhali child. And the different themes for that age group focus around health, around development, around nutrition, also the maternal well-being, because mental health, even though this was very much originally focused on the physical health of the mom, the mental health has, probably not a big surprise to many of you, come out as the most important thing. So it's trying to understand how do we support caregivers. And I think this project, more than anything, has really helped me to see if we're wanting to support young children in their developmental and their health trajectories, we have to work not just with the mothers, but with the caregivers as well, and understand how far back do we need to go to actually put those things in place. So I could stand up here all day and talk about our process evaluation. So that's just a snapshot of the many different studies we've done. Most of them are qualitative. And so we've really tried to see how can we capture these young women living in this community of Soweto, which is an enormous area outside of Johannesburg, where the hospital Sarah mentioned is located. It's diverse in terms of economics, but predominantly low income, many challenges. It's got a very storied historical context in terms of, political goings on, and in many ways feels like a textbook case for intergenerational trauma. So we use the UK MRC guidelines on process evaluation, which very nice and neatly look at implementation, mechanisms of impact and outcomes. But we have found that when you add all of these things, none of the lines are straight. So it's all really messy, but it's really helped us to understand how a trial running over long term, intervening, but also measuring, is really complicated and really complex. But it's been amazing to see how the different types of data, so really rich quantitative data, we're just busy wrapping up the preconception phase of the trial with the young woman, seeing how the quantitative and the qualitative really complement each other and tell a really compelling story. And then the next thing I want to tell you about is this project I've been working on called Mazi Umntanakho, which means know your child. And this project kind of came from after many years of being in the ECD sector, working in centers, getting to know the different organizations working, that young children's social emotional development and mental health really needs more attention. And the more we spoke to people and said, this is important, no, we do social emotional development. But once we started talking about it, they realized maybe we don't do it enough. And certainly mental health is not something that's commonly spoken about in young children, at least in our context. And there are many, many barriers to access the kind of help that children who are needing it can actually get, particularly in low-income contexts. But more and more evidence is coming out from studies in South Africa showing how social emotional skills and early learning are really well linked. And so there's this kind of momentum around understanding how important this is as the bigger picture, as part of the bigger picture of ECD in South Africa. And we know we can't replace the services that children need of a social worker, of a psychologist, of a speech therapist, but we can help build capacity at a community level to really empower them with understanding, with awareness and knowledge. And in our sector, in our context, we have to work in partnership with the organizations who are already on the ground, who are already working at scale across urban and rural low-income settings. And the project came about through a network and some fundings from the Jacobs Foundation around EdTech, and how could we think about what role could mobile technology help play in helping us to actually achieve this. So the tool is a WhatsApp chatbot, and I'll explain what it does. But I first just want to highlight working with computer scientists. Co-design is just the way you do it, according to them, which I feel a lot of people in public health could learn a lot from. And so we worked with selected community-based organizations and their community-based workers, be that home visitors, community health workers, ECD practitioners, to really understand what are the needs, what are the priorities, what could work, what did they think of the ideas that we showed them, how could we then kind of bounce those ideas back and forth to develop something and then train them to actually pilot and implement this and then evaluate. So the first section really highlighted what is the context. And we looked through the lens of the nurturing care framework, what are the risks to children's social emotional development and mental health in these contexts. And unfortunately, the risks far outweighed we did want to look at protective factors, but there weren't many. The risks really outweighed the protective factors. And these two quotes just highlight some of the cultural and social barriers to actually talking about these issues. And even as we did the training, realizing that the home visitors themselves, one of them said that, their parents didn't say they loved them, so we don't know how to say this to our own children, and really just highlighting many of the challenges, the abuse, the violence that children are exposed to, and the risks that it placed on them. So that, for us, many things we kind of knew already, but it really just helped us to document that, to provide a good rationale for why we wanted to do this. And through many, many, many focus groups with the community-based workers, getting their input on what the tool should look like, they really affirmed that these are important topics to address. Unfortunately, stigmatization of developmental challenges is still very common. They agreed that there was a lack of accessible services, and we proposed 2 different assessments. And unfortunately, in our setting, given the challenges of our education system and limited opportunities for people to be educated well, arriving with a blank sheet of paper or a blank whiteboard often is very overwhelming. So we thought we would present what we thought could work, get their feedback. And the 2 things we presented were first the Strength and Difficulties Questionnaire, which many of you would be familiar with. It's been used widely around the world, translated in many languages. And then the IDELA, the Save the Children's International Development and Early Learning Assessment, just the social emotional component. And thankfully, they thought these were great. They gave us the thumbs up on that. They agreed, they fed back to us that WhatsApp was the preferred digital platform. We thought this was going to be what they would come up with, rather than a new app that you had to learn, and how much space is going to take on my phone. Data is still very expensive in South Africa. How much data is it going to use? So WhatsApp is something that people are really familiar with. And part of it was to say, well, what not just doing the assessment, but what resources could we provide you with, they were keen on a variety of resources. So if any of you have been part of these kind of processes, you say, well, would you like pamphlets or infographics or videos or voice notes? And they're like, yes, please. They want all of them. And the language of these was really important. We have 12 official languages in South Africa, including sign language. So how it works is it does three things. Firstly, assesses, provides feedback, and gives resources. So the assessments is the IDELA, social emotional section, which is done with the child. The SDQ is done about the child, either with the caregiver directly or by a practitioner. They then give simple feedback. So this is really where the technology shines, is no one has to work out any maths or scores or look at cutoffs or anything like that. That's all done on the back end in WhatsApp. And we use what we call in South Africa, I don't know why the South Africans in the room will know, we call them robots or traffic lights. So green, everything's good. Orange, some things to keep an eye on. Red, we need some extra help here. And we found in other projects that this really simple traffic light system works really well and is easy to understand, and maybe many of you might use it in your own work. And then we developed a set of resources, as I mentioned. And this is, I know you can't read the writing, but it's just so how cool they look. So we decided on 5 themes. So instead of saying, well, here's a pamphlet on ADHD or autism, knowing the stigmatization, we'd say, but what are you trying to say about my child? We thought we'll do it on kind of general themes that could be beneficial for any child. So emotions, social skills, difficult behavior, self-awareness, and healthy habits and routines. And these are the infographics that really capture what is the main message behind that. And given the diversity of South Africa, we kind of opt for this cartoony kind of design that we have found has been really appealing kind of across cultures, across settings. And we incorporated then the movement guidelines to go with the healthy habits and routines. So lastly, just to talk a little bit about the piloting, the feasibility and the acceptability of this. So we've completed a pilot where we did this with home visitors. That was done in 2023. Currently underway is a pilot with ECD practitioners where I have trained either the trainers or the practitioners directly, depending on their model, from these organizations working in urban and rural settings, and they have been given the tool, and some have done it really fast and some are going a bit slower, but it's underway. We've given them printed resources, so providing things on websites and all of that just does not work in South Africa. So people do actually prefer having pamphlets in their hands. And because we are not paying them to do that, we give them some goodies as well. So branded things with our logo, just as a way of affirming what they're doing and the role that they're playing, and that we appreciate that. And the key things that we've learned, it has been positively received. Co-design is absolutely critical to make sure that it's contextually relevant. We have to work within the technology limitations that we have, but that even with something really simple as WhatsApp, they need lots of time to build confidence, not just the competence, but to actually build the confidence in using it. And that there's no one size fits all. So in each organization, everything is being implemented ever so slightly differently. And so it's been building that flexibility in as part of the program, as opposed to feeling like we are compromising on it. And that organizations are extremely busy. As I'm sure they are here, there's lots of work to be done. Funding has got even worse in the last year. So they all, in many cases scrambling. So it's working then out of that relationship of trust and partnership with them to understand how can this be a value to what they're doing and not a burden. And we really now hoping as a next step that this tool could be handed over to these organizations for them to use ultimately to improve the lives, not only of the children that they work with, but the families and the communities. So thank you very much, and just want to acknowledge the many, many students, collaborators, funders who've been behind this work. Thank you.
Thank you. Thank you, Kathy, for this super inspiring talk. And I just always sit in awe when I hear you talk about your work. How do you do any one of these projects, let alone all of these projects? It's absolutely incredible. Your contribution is really awe-inspiring. So we have time for a couple of questions, and we have a microphone that can be passed around. Oh, you were showing the mic. I thought you were raising your hand. No, just showing the mic. There's one over here.
Thank you so much for your talk. I'm Rushda Majid from the Bernard Van Leer Foundation. I was curious about if you've used any tool or collected any kind of parental feedback, or you've seen good examples of this. We're looking at it now within the foundation, are quite curious. Thank you.
You say parental feedback.
Yes, parental feedback.
Yes. So at this stage for the Mazi project, we are relying on qualitative evaluation for that. And we found that I'm a qualitative researcher at heart, so I find that that's where we really kind of get the richness and the nuances of that. Um, yeah, I think that's what for that project, there's no team, it's just me. So we are, we have funding, but kind of limited human capacity. But it's also then working with the community organizations and the organizations that we've chosen to do the pilot, or those who are interested actually already work with caregivers. So there is kind of that feedback loop. And I think it's, in these contexts, it's often quite intimidating to kind of come in and fill in a test or fill in a survey, but it's really kind of drawing on kind of ongoing feedback with the organizations to understand how the caregivers are experiencing these kind of things. Yeah.
Thank you very much. My name's Kathy Silva from the University of Oxford. I want to ask you about your outcomes because you've told us how contextualized the intervention is, the way you work with people, and yet you use outcomes, the SDQ and the IDELA, which are used all over the world and were developed in very different contexts. So, can you explain a little bit about how were so contextualized in the intervention and co-produced and co-designed, and yet we seem to use the same outcomes everywhere?
So the choice of outcome measures is very deliberate. So we have used the IDELA, is optimized for use across global diverse settings. And we've used it in South Africa before with success, and that's the reason that we chose that, and that it's simple questions. And where we can, given the age of the children, doing something directly with the child is really important in addition to caregiver feedback. The strength and difficulties questionnaire, again, has also been used very widely around the world. It's been used in South Africa. We did translate it into all the languages that we're using. And, we were not entirely sure how it was going to land and how they were going to respond. But actually, in the first pilot, the caregivers, when they did it directly, they actually found that the SDQ questions to be the most impactful part of the intervention because they hadn't thought about these questions before. So I think it's finding that it's a tension that we hold between the contextualized, but if we say, well, nothing is universal, and we've had this discussion about executive function, then we risk throwing the baby out with the bathwater. So it's using those kind of tools in ways that we can test that, as not putting all our eggs into that basket first, but using it within pilot work to see how it works and draw on that. And again, where the qualitative feedback from those who are using it and engaging them in the design process really makes sure that that becomes contextualized as well.
Going to make your quality so much more important. So,
Thank you. And unless you want to respond, I think we can finish there. So, what we're going to do next, before thanking Kathy one last time, is just think about the workshops we're going to. So, you might remember that you were asked to make a decision and have a think and perhaps even book yourself in to one of the following two: building a community for policy change or neurodiversity affirming play. Hopefully that rings a bell. It's okay if it doesn't. We're not going to be too strict about it, but if you booked yourself in for building a community for policy change, you will be heading out of here. No, you will be staying here. Just checking if you're listening. So you'll be staying here, okay? And if you booked yourself in for neurodiversity affirming play, then you will be heading out of here, going down the hallway, and there will be people to point you in the right direction. You're just going to the other end of this building to a large room down there for that workshop. So neurodiversity affirming play, you will go down there. Before you leave, let's thank Kathy one last time. Thank you so much.